Hey guys, this is Dr. Hub. Now let's look at the obstetric indications for the GA, that is a general anesthesia. So what is includes? It includes the fetal distress. So in terms of the fetal distress, and this is during the second stage of labor. Next, there is in terms of the tetanic uterine contractions. There's a tetanic uterine contractions. Then there is also the presence of the breech extraction. So in terms of the breech extraction, then in terms of the version and extraction, there's a version and the extractions. Next, in terms of the manual removal. So in terms of the manual removal, and this is of the retained placenta. The retained placenta, and also the replacement of an inverted uterus. The replacement of inverted uterus. Then next is in terms of the uncontrolled psychiatric patients. Uncontrolled psychiatric patients, and in the LCS in patients, LCCS, that is a lower cesarean section. So here this is in patients with the rheumatoid heart disease, so we're writing it as RHD, and the mitral valve stenosis, we are writing it as MVS.